Miss Advisor, dear Senators, dear Deputies, dear officials, journalists, ladies and gentlemen, and of course, dear Presidents. First of all, I would like to thank you all because it's a great honor to be here with you today, celebrating the 4th year of the safety features in Romania. And also, it's a pleasure to be with Razvan, who acts widely and strongly in order to upgrade the position of Romania, not only in a local level, national level, but also in European level. Also, it's a pleasure being in a country that we have common relations, religious, financial, and cultural. So it's not just a partner, but I will consider us being a friendly country. And this is going to be the next step because you are the welcome country for us into the safety features. My presentation here has a different role because we are one of the two countries, Greece and Italy, that had not entered yet the safety features, the European safety features that we're discussing today. And I'm here to tell you our story. And through this story, you will see that we have developed through the years a unique system for falsified medicines, and so on. We have our own experience, and we discuss this experience with you, with the Romanian agency, with the European Union, because every system has advantages and disadvantages. So I'm here to present something new, old for us, new for you, our Greek experience. I don't know how it works. Anyway, okay.
Left, right.
Okay. All this starts in 1987. Our organization celebrates this year the 40 years from its foundation. It is founded in 1983, EOF, National Organization for Medicine in Greece. 4 years later, they thought, the people that they were handling the things then, that we should do something in order to find a solution how to occupy with the medicines, because there were significant problems. And they thought that we develop an authenticity sticker. That means a label that we put on a single box. Why to do so? Because we would like to find the solution in 3 things: authenticity, identification, and of course, traceability. And I note previously that also the minister and also my friend Razvan noted the falsified medicines and the e-commerce through the net. So we have to define that we're talking about 2 different things. One thing is the legal route of the medicines, and for this route we develop this system to control it, and the other one is the illegal route. For this, the only thing we can do is education. We have to educate the public, the patients, that is for own good to take care from where they buy medicines. So, after these thoughts, can we have the next, please? Okay, so we developed the authenticity sticker. What are the unique features of this sticker? Next, please. Next, the authenticity sticker is developed in 2 layers. The first layer is put on the box and is strict into the box. You cannot take it out. The other part, the upper part, is on the top. And it was the part that he used in the past to take it off and put it into the recipes in order to ensure that it was the correct payment of the drug. So we have one piece with a number on the box and one piece that was used for for reimbursement reasons. Each sticker, next please, had specific characteristics that they're unique. First characteristic was the watermark. The watermark. Can you press it again, please? In the watermark, we have 3 numbers, as you can see inside. And I will explain what are these 3 numbers. And also, please press it again, we have a fluorescent design, very complicated as the design that we use in notes and in stamps. This design was changed every year, so we avoided any attempts to reprint. Next, please. We have also, as you can see, the 3 numbers. The first number was a sticker barcode, a unique serial number. The second number was the MH brand name, all the characteristics when we give the license to the medication. And the third was the product barcode that was given by EOF. Next, please. Next, please. We also take, again, okay. Each number showed something. First of all, in the stickers, we have the year and a 10-digit serial number that it was given. In the product number, we have the code from the product, the medicinal product, and also we have a 9-digit number that it was given by EOF, and finally, we have an automatically produced number that put into the label. Next, please. So, this combination of these 2 different numbers, the sticker barcode and the product barcode, one given by EOF and one from the MIH, made each product unique. And so, by scanning these 2 numbers, we were able, for the last 25, 30 years, to know everything concerning the cause and the coming of each box. Next, please. Except all this, we also used different colors to be easy to recognize. So the brown colors was for medicines that were not subject to medical prescription, that anybody can go to the pharmacy and buy it. The black one was for the products that the patient should have a medical prescription in order to buy them. The blue was the hospital line. The green were the products that can be taken for a specific time period. And finally, we have the pink or red one, where the products that were coming urgently under specific circumstances in the country by parallel import. Next, please. So, with these stickers, we try to manage all the distribution in the area of pharma the last 30 years. So, this was the main idea. And in order to perform this idea, we set up a whole IT system in order to follow up all these medicines. Next, please. How we monitor it? We had a contract with a specific provider who developed the software, and we were in close contact with them. Next, please. What the system offered to us? Continuous monitoring, and of course, we have every information in real time. And well, you ask me, is this important? Yeah, it's very important in specific conditions. Like this year, we have a significant problem with shortages all around Europe. So with our system, and I will come to, in the end, I'll refer the specific points. With our system, we are able each moment to see what has been imported in the country and what has been distributed. So we were able to take care of possible shortages. Next slide, please. So we needed to know about the authenticity and the traceability of each product, and so we developed the system. Next, please. The system has specific characteristics concerning a software. And as you will show in continuously, it was a system that referred not only to the stakeholders, that means to the companies, to the wholesalers, to the pharmacies, but also to the public, because gave also to the public the chance to search and find if the medication that has been provided is false or not. Next, please. We had two checkpoints. The first checkpoint, as you can imagine, was the terminal point. That means that the patient goes to the pharmacy, takes the drug, then they scanning the sticker and they cancel the barcode because the medication has been sold. And the other point is where we had an alarm about the authenticity sticker. Next, please. And how the system works practically. The MIH goes to the EOF, to our organization, and orders, says that I'm going to import this amount of medication, so I need to give me the labels, because all these labels are paid and printed by the National Organization for Medicines, and we control everything. After the MIH places the orders, we approve the orders after controlling everything, and we print the stickers. Next, please. We give the stickers to the MIH and goes to a special place where places the stickers into the box. If there is a false in the printing or putting the sticker, then the stickers are dispatched. All the other that is correctly put, then announced to the OFF to enter them into the system and then sent into the community, into the market. Next, please. They can send the medications to a wholesaler, and the wholesaler can export it to the other countries of the EU or give it to the patients and to the pharmacies. Or, next please, directly the company can go to the market or provide the medication to private clinic and to the other structures of health that they provide medicines to the people. So we have the company can provide by itself or goes to the wholesaler and gives, but everything is reported to us. Next, please. So the last years, we handled 2.5 billion stickers. That means that we have 2.5 billion different boxes, different medicines, and a large number of users, almost 300 users. That means the pharmacies, and 100% success. We didn't have any falsified medicines during the legal route. I mean, the legal, not illegal. I'm buying a medication, put it in the pocket, and go and sell it in the market. So, next, please. This was a large experience. And as I told you, the system refers to everybody. We control the system, but everybody has access to see what is interesting. For example, the patient can go to our page in OFF, although it's an old page, it's an old modern page in the internet, but it is useful. Can put the number and see if the medicine that buy in the pharmacy is false or not. Next, please. Also, for the stakeholders. The stakeholders can also have access to our system in order to see if the boxes that they have are correct. Next, please. And also the companies. Next, please. And what are the lessons from this? What we achieved to do? We achieved the last 35 years to be pioneer in the area of safety features in Europe. That's why we took an extra extension in order to make all the necessary preparations to switch from our system to the European system. But during our vast experience, we found that there are some differences concerning the existing European system and our system. First of all, is who pays? This is the difference. We pay. We pay, but we are not stressed because we control everything. We have everything in our organization, and at any time, 24 hours, 365 days, we can have access to any data we need in order to see about shortages, and the most important, to see about reimbursement. The pricing policy and reimbursement policy that have been set up recently in Greece, the HTA and negotiation committee to whom I was former president and I set up all the procedures, was set up delayed 3 years in Greece. But we have access to all these documents so we can proceed it in with all negotiations, with all reimbursement procedures, and of course, to use all this data in order to form our therapeutic protocols where we shall base a new pharmaceutical policy. So, the main question is, we have a system. Do we use the system to upgrade our pharmacy policy and to prevent expenses, because it's a main problem in all economies, and especially to our countries, which are not the richest countries in the world, okay? So we should take care of anything and everything that should ensure a correct pharmaceutical policy. Then the second difference is who pays. We pay, on the other, the industry pays. And of course, is who collects the data. This is very important because in our system, all the data are collected by a public organization. On the other system, the data are collected by a private organization. Anyway, this is something that the discussion will go on. I just wanted to show our experience, what we learned, and what we would like to tell to the others that they are entering in the area of safety features the last year. And I don't want to speak anymore because I speak all the time. Just to thank again Razvan for the kindness, and I'm very honored to be in this wonderful place today with you. So thank you very much.